It's midday in Freetown. Good afternoon and welcome to the podium coming to you live from the Sierra Leone Broadcasting Corporation. My name is Zulaya Hamid. Our quote of the day comes from Peter Coppin, a Russian economist, and it says, true progress lies in the direction of decentralization, both territorial and functional, in the development of the spirit of local and personal initiative and of free federation from the simple to the compound in layer of the present hierarchy from the center to the periphery. Well, coming up in this edition of the podium, councillors of Freetown City Council dissolved the Budget and Finance Committee. Sierra Leone yesterday received another consignment of COVID-19 vaccines with 264,000 doses of the Johnson & Johnson. And the Ministry of Tourism and Cultural Affairs today launched the World Tourism Day celebration, and the University of Sierra Leone Teaching Hospital has commenced the first postgraduate training of obstetricians, gynecologists and pediatrists at the Oladurin Children's Hospital in Freetown. Well, these and more issues, including your comments, which you can send to the number 088-373-504. 088-373-504. This is the podium. We'll be right back after the short break. Welcome back. If you're just joining us, this is the podium coming to you live from the Sierra Leone Broadcasting Corporation with me, Zulaya Hamid. Don't forget you can send your comments to the number 088-373-504. 088-373-504. Now, Sierra Leone yesterday received another consignment of COVID-19 vaccines with 264,000 doses of the Johnson & Johnson at the Lunge International Airport. My colleague Joseph Tui was there and he sent in this report.
Please, I symbolically hand over this pallet to your government. On behalf of the government and people of Sierra Leone, I received this from Brussels Airlines, the Johnson & Johnson vaccine, marking the diversification of vaccine portfolio in the country. Thank you. Thank you. But of course we also have other and multilateral partners, including the World Bank, the WHO and UNICEF. So what we are receiving today is a very significant consignment. The public would recall that this government has always been making very positive indications about diversifying the vaccine portfolio in the country. We started off with Sinopharm and the Oxford AstraZeneca. Today we are receiving 52,800 vials of the Johnson & Johnson, which actually contains 264,000 doses of the vaccine. We want to say thank you, big thank you to AVAC with the strategic partners, the African Union, and the African Union itself, and of course UNECA, United Nations Economic Commission for Africa, as well as our multilateral strategic partners, WHO, UNICEF, and the World Bank. That is exactly why we're here today, because we have seen significant appetite for vaccination in Sierra Leone. We are experiencing significant uptake in the vaccination, and having this very important consignment from Johnson & Johnson is the right step in the right direction to diversify the vaccine portfolio in the country.
To have to be part of something strategic and phenomenal in Africa. It is a wholly African initiative for Africa, by Africa. This is the J&J single dose vaccine, and it's part of a grant to vaccinate 1/3 of the African population. This will go a long way in helping strengthen our immunity and our whole system. Thank you.
Thanks to my colleague Joseph Tui for sending that report. You can send your comments to the number 088-373504, 088-373504. Now, the Ministry of Tourism and Cultural Affairs today launched the World Tourism Day celebration, which is slated for the 27th of September, where the World Tourism Organization focuses on tourism for inclusive growth. The COVID-19 pandemic has had a massive social and economic impact. Both developed and developing economies have been hit, and marginalized groups and the most vulnerable have been hit hardest of all. The restart of tourism will help kickstart recovery and growth. It is essential that the benefits will be enjoyed widely and fairly. Tourism is an organized pillar of most, if not all, the sustainable development goals, including no poverty, gender equality, decent work and economic growth, and 10 reduced inequalities. Well, for more on this in the studios, I have with me Maligi Kamara, who's a tourist officer. Good afternoon, and thank you for joining us on the podium.
Good afternoon.
Yes, as in terms of celebrating World Tourism Day, what would you say in terms of the impact this has had on what you actually do?
The World Tourism Day celebration is being celebrated to raise the awareness on the immense contribution of tourism within the development of the economy and the nation as a whole. This celebration is to raise the awareness to people, see how best we can work with the 17 SDG and transform the lives of the community. Explain to people about the contribution tourism makes to community and how tourism can create decent job for people. Tourism can eradicate poverty, and see how best we can mitigate climate change, and come up with strategies that can help us to further the development of tourism. So this year's celebration is purely going to be a collaborative one wherein we can engage key stakeholders, because tourism is a private sector driven, and we cannot just continue with whatever development without the active involvement of the private sector. That's why we want to collaborate with them and see how best we can address the issues of tourism. What are some of the challenges? How best can we address this despite the outbreak of COVID-19? But what are some of these challenges we can implement, to see how best we can promote this destination?
Speaking of the challenges, one would be the impact of COVID-19.
Yeah, the impact of COVID within the sector.
Exactly, and the redundancy this has caused.
Yeah.
So what would you say in terms of reviving what has been lost?
Okay. In terms of reviving what has been lost, it will be very difficult, but yet, it's a collective effort that I've already said. It's a collective effort wherein we need to come together and work as a team, because the private sector are key in this. So we need to come on board and discuss what are some of the challenges. Now that the outbreak of this COVID has disrupted the sector, and it has affected us a lot, but we need to find ways as we can continue the development of this sector. So we need this engagement. We need to discuss issues about some of these challenges so that we can lift the destination again.
Speaking of private companies coming on board to ensure, the revive tourism, how far have they gone with that? Is Sierra Leone at the right footing for that?
Yeah, because when you look at the activity currently being undertaken by the ministry, it's purely geared towards that. See how best we can improve on our collaboration. Even though we've been collaborating, but yes, we need to improve on the collaboration. See how best we can promote public-private partnership. Discuss. They have their challenges. The private sector, they have their challenges. Then let's see how best we can come in as a ministry to address some of these issues so that we can move this nation forward.
Okay, let's now talk about local tourism here. Lots of people think that you have to leave the country to explore, and many a time that's not the case. So in terms of ensuring that people get to leave town and go to board or those other areas to actually explore, where do you see ourselves as of now?
That's why this year, 2020, we decided as a ministry to name it the year of domestic tourism promotion. You know, we have a lot of touristic sites within the provinces. I mean, we need to encourage people to make use of these sites, make use of this tourism potential we have as a nation. So that's why this year's celebration is not going to be limited in Freetown. We need to go to the provinces, see what are some of the things that are affecting the development of tourism there. Engage them, discuss on these issues so that we can improve on our domestic tourism promotion and encourage people to make use of this potential we have at the regions. So that's why this year is purely focused on domestic tourism promotion.
You know, what about making those sites, fruitful for those who want to actually go there? Because another area that many times people get to speak of is security issues. They actually want to go there, but they are afraid that the security is not that of a high demand.
Yeah, there comes in the issue that I earlier on mentioned of the improvement of the private sector collaboration. We cannot do this alone. We need to work together as a team where we can collaborate with other players, bring them on board, see how best we can address the issues in the provinces, and also create the enabling environment, encourage the private people to invest in this area, because I mean we can only make use of this potential if there is the needed investment. So you see, so that's why we need them on board.
You know, some months back, Idris Elba came to Sierra Leone, and in Ghana they have the year of return where a lot of celebrities go back to Ghana just to boost their tourism sector. So I'm just wondering, from that time when Idris went there, are there any, in terms of improved access to the particular area to ensure that yes, people actually go there to see?
Yes, I mean, you're talking about Bond,
yes,
right?
Yes.
Since the coming of Idris Elba, a lot of development has taken place in Bonn. One of the key thing that has been affecting that area is the area of the jetty and that of the clock tower, which has been restored by the ministry through the Monuments Against Commission. All these things have been, but yet still we need to do more. We need to improve that area so that people can go there and make use of this opportunity that are there.
Okay, another thing I want to draw to your attention is the Mambo site. A lot of people have been going there. So at some certain time, people were asking for monies to be collected just that they get to preserve the area and raise some funds to ensure that yes, it is kept clean and the like. So in terms of keeping people abreast with those areas and actually ensuring that they get to go there.
Yeah, the ministry has been working with other MDs to see how best we can develop that area and make it more tourist friendly, because that area cannot just be like that. But I mean, as I said, collaboration is very, very important. In as much as we've set up this inter-MDs working committee, yeah, we need to work as a team so that these places can be served. So we are working with other key stakeholders that are involved to see how best we can develop that area.
Okay, let's go a day in your life, in terms of the tourist, as a tourist officer, what do you actually do? Because let me draw your attention again, a few months back, a lot of African Americans came to Sierra Leone and they were given local names and they ate local food just to ensure that they are brought back to their origin.
Yeah, okay, that is also part of our promotion of the domestic tourism, and we refer to it as culture tourism, root tourism, going back to their root and see how best because we've been, since 2018, we've been embarking on promotion of international tourism. Sell Sierra Leone out there, but we thought it necessary that this is a time wherein we can come back to our country and sell what we have. The coming of this African American is part of the initiative being created by the ministry to bring them on board. And most of these people that are coming to sell, most of them are business people, so we need their expertise. We need them to come to invest within the sector and see how best Sierra can become a sustainable destination wherein tourism will to be visited.
Okay, so in terms of meeting with those in charge of various tourist sites, let's say for example number 2, you get to go there and they get to ask you to pay some amount of loans to sit on their tables just to ensure they get to maintain standards. So how do you get to collaborate with other beach sites apart from number 2?
Okay, apart from the ministry is currently working with the World Bank on the economic diversification project, wherein they intend to develop so many sites within the country, but they will start with 5 sites, of which number 2 is part of it, and on other area are also part of the project. The likes of Leicester Peak, Takugama, they are also part of that. So we are trying to develop this site so that people can have diverse aspect of tourism, because not everybody like beach tourism. There are also other areas where some people like nature. They will go to Takugama and meet with these chimps and all the rest. Some would like to visit the Leicester Peak, go there and have the beautiful scenery and all the rest. So that with the economic diversification project, we want to expose all this area, open them to people, ensure that the public access them and make use of these beautiful things we have.
Okay, thank you very much for taking your time to talk to us. He is Maliki Kamara, a tourist officer as World Tourism Day, which is slated for the 27th of September, would be celebrated. If you are just joining us, this is The Podium, coming to you live from the Sierra Leone Broadcasting Corporation with me, Zulaya Tuhami. Don't forget you can send your comments to the number 088-373-504. Moving on with The Podium, Koso Town Descendants is distributing school supplies to the children of Koso Town. This is the second time the organization is making such donation to support free quality education. Jibril Kamara is the Chairman, Education Committee, Koso Town Descendants. Good afternoon and thank you for joining us on the program.
Good afternoon. Good afternoon to you.
Yes, let's start with the supplies that were disbursed. Take us to actually what you did.
Well, actually what we did was we decided to choose about 5 primary schools living within the Koso Town community, and then divided the community within 5 zones to make sure that within those communities we have our zonals. They went within the communities 1 to 5 zones and make sure that the kids go into school within that Koso Town community, of course, that they are registered along with their school report cards, because at the end of the day we are looking at school supplies for the children of Koso Town, brains of Koso Town, and also scholarships for the children of Koso Town. So that's why we are asking them for their report cards, so that we will know when it's time for us to come back and help with scholarships. We'll be able to identify these kids within their various communities.
This is not the first time you have been doing this. How do you get funds?
Well, actually, most of the funds are coming from the diaspora. Most of our brothers and sisters, because we have branches within the diaspora, the UK branch, Canada, and US, along with the home-based branch here, that are really organizing the resources to help.
Okay, so let me come in. For those who receive the scholarships or school supplies, how do you get to choose them? You made mention of some schools you get to choose.
Yes, definitely, yes. Out of those 5 schools, we have 5 of them existing within that Koso Town community. Of course, we have the St. Philip's Primary School, of course, Ahmadiyya SLMB School, Olphin Street, and Krojimi, and also Pentecostal Primary School. Those are the 5 primary schools we have identified and do their registrations.
But apart from the supplies that you get to give them, let's talk about mentorship now. How do you get to provide it for them? You do not have to give them only books and pencils, but just ensure that they get to stay in school.
Well, actually, what we are trying to do is to consolidate the effort of, the free quality education. So that's why we thought it fit to see how best we can help out, with school supplies. Actually, the school bags are coming along with 6 exercise books, 5 pen and pencils, and along with geometry sets, highlights and others, and the rest of it. And we are also giving out 20 school chairs and desks, along with blackboards, 5 blackboards to each of those schools. So it's like after this distribution of school supplies, we are going to come back and give the schools those school furnitures for the upcoming school reopening.
Okay, this comes at a time when the baker results are out, and in terms of sending messages to these kids and the teachers as well to ensure that they get to maintain what you have given, what would you say to that?
Well, please do study hard and do your homework, and Kitty will always come back and do the best that we can to help out, in the educational process of helping kids within our community.
Okay, thank you very much, Jibril Kamara, the Chairman, Education Committee, Consultant Descendants. We're going for a short break. We'll be right back.
Thank you.
Welcome back. This is the podium coming to you live from the Sierra Leone Broadcasting Corporation with me, Zulaya Hamid. Don't forget you can send your comments to the number 088-373-504. Moving on to the University of Sierra Leone Teaching Hospital has commenced the first postgraduate training of obstetricians, gynecologists and pediatricians at the Oladirin Children's Hospital in Freetown. The training is targeting 7 obstetrics, gynecologists and 4 pediatricians. Obstetrics is the care for women during and after pregnancy. Gynecologists specialize in disease of the female reproductive system, and pediatrics is the branch of medicine that deals with the treatment of children. Sierra Leone is said to be among countries with the highest rate of child and maternal mortality in the world. The figures from the Ministry of Health reveals that over 19% of babies and women die at childbirth every year. Well, for more on this in the studios, I have with me Liam Mahota Rikspa, who is the country director of Mama Pikin Foundation. Good afternoon, and thank you for joining us on the podium.
Thank you for having me.
Yes, this training, tell us what led you to, organize all of this.
So this is a concept and an initiative that has been in discussion for almost 11 years, since 2010. Ministry of Health wanted to make sure that we can address this looming rate of maternal mortality and child and infant mortality here in Sierra Leone, which has plagued us as a country for many years. But unfortunately or fortunately, it is now that the program has begun and launched, and we're very proud of what we're able to accomplish. This is not just the Mama Pikin Foundation, but also in partnership with the Ministry of Health, with Freetown City Council and the Mayor of Freetown, and of course with the hospitals themselves, PCMH and Oladirin Children's Hospital.
Yes, please go.
So, we basically came together to make sure that we can have and house our own specialization training in obstetrics, gynecology, and pediatrics, so that we are not having doctors who go to medical school, go to commerce here, and then go out for specialization and never return. Because as of now, before this program, there's only about 10 doctors in both the fields of gynecology and pediatrics in the country, in the entire country. So when we have issues or complications that come up in pregnancy, labor, or after childbirth, in order for you to get to see a specialist, it takes a long time. The capacity is very, very low, while the demand is very high. So this is an effort to address those issues. As you said, we've commenced yesterday. As of yesterday, September 1st, we're very excited. We have a total of 11 residents. Although the number seems small, we hope to build upon that. It's just a start.
Okay, let's now talk about, the gynecologist aspect that you are doing training on. Many a time you get to talk to women when these free trainings are done for even checkups, and they, it's as if they're frightened and terrified to be, to go there and to be told something else is wrong with them. So for this training and ensure that it will be utilized, what have you done so far, or some of your findings you have?
So really what we're trying to establish here, this program is a 3-year program. So this is not a short program.
Okay.
This is a program to ensure that doctors are well-rounded in the disciplines of obstetrics, gynecology, and pediatrics. We'll have trainers from all over the world, even remote virtual trainings and things like that from people abroad. We have brought in West African certified trainers in the fields, both the fields, to come in and train all of our residents. And we also have them placed at both of the tertiary institutions for healthcare in the country, which is Oladurin and PCMH. So they will be able to be exposed to many different cases, be able to be led and directed by people who are very well seasoned and highly knowledgeable in this field.
Okay, you get to deal with mothers and babies, as the name of your foundation implies.
Yes.
Mama Pikin Foundation. But let me ask you this: your contact with them. What have you found out so far in terms of analysis? Because you get to see a lot of kids, they get to be sick, and it's as if it's until the last minute they rushed to the hospital because of negligence. So in those cases, tell us about some of your findings.
Yeah, the negligence really, if we look deeper, obviously there's more to just negligence. People are afraid, as you said earlier, as you alluded to earlier. And there's lots of reasons why they should be, because people go to the hospital, they die. Many of them fear that they'll die, or they will be treated with respect. They have to spend a lot of money. So the Mama Pikin Foundation is very cognizant of those things, and we have a lot of other projects and initiatives where we are engaged with the community. We supply buckets. We have a buckets program where we go and supply to the PHUs, various PHUs, buckets for women that were born, obviously. And they get their buckets so, they can actually come and transport, we give them transport. But we're hoping with this particular training that we're able to address some of the socioeconomic issues that are also plaguing the people, which is why they don't like to come to the hospital, and they often wait until it's too late. And that's why there's such a high death rate, because when you wait too late, you show up the hospital steps nearly dead yourself. It's difficult for the hospital people or anybody working there to revive, So we're really trying to work on that and help with the skepticism and with all of the doubts that the community has. Okay,
with the prenatal care and postnatal care now, in terms of, again, your findings that you have, let's start with the prenatal care.
Yes. So prenatal care is, or antenatal, is where the mother comes in to the doctor for regular checkups during the pregnancy, during and throughout the pregnancy. So that's supposed to be twice a month, and earlier the pregnancy, and towards the later part of the pregnancy, every week. And that's just for low risk pregnancy. But the issue is, once low risk turns to high risk, there has to be someone who is knowledgeable to be able to identify that there's a change. So perhaps the feet are swollen, or perhaps it's a diabetic issue. There's lots of different things that can lead to complications during labor. And one of the highest reasons why we have, one of the biggest reasons why we have maternal mortality in this country is due to hemorrhage, which basically is a medical term that means bleeding, excessive bleeding. And we all know that we don't really have sufficient blood bank reserves here. The only place that has them currently is Connaught Hospital. And so wherever you are giving birth, if there is a bleeding issue and you need reserve blood, you have to get to Connaught. And so How can you get there on time? Will it be enough time? Will it be enough blood? All of these things, and you have to pay for it. So all of these things are things that if we see them earlier on, this is the reason why prenatal or antenatal care is so important and critical, because we can catch things earlier before you get to labor and delivery.
And the postnatal care.
And then postnatal care is also very, very important, where we are actually looking at after the birth of a child, looking at the health and the well-being of the mother and the baby. And so it's a very critical time between that 6 weeks after you give birth to make sure that the mother and child are being monitored. Visits by the nurses or midwives, checkups, regular checkups on a weekly basis until you get to the 6 week mark. So that is very critical as well. Many children die during that time.
And okay, let's stick with the postnatal care now. In terms of teething, what would you suggest? Because many times we get to find a lot of children and mothers, particularly in traditional settings, they get to prescribe some sort of remedies that, well, for them it worked and they are passing on some tradition. So I'm sure you've met with some of those women.
Yes, of course. I mean, I think throughout pregnancy, you have people who are always coming to you and say, oh, that's what for do, that's what do, that's what you for do for this speaking. And I think there's a delicate balance. Yeah, there's lots of them that might work for your child, but then there's also some of them that has been traditional but really not shown to work, right? So like, for example, giving children or babies, infants, water, right? We already know that our water supply is not the best. We cannot expose our children, our babies, our infants to our water supply earlier on in life when and if you are able to breastfeed, you should. Because breastfeeding is something that has not been contaminated by anybody. It's like from God to man, the same way that coconuts from God to man, nobody and touch them. So it's best to do breastfeeding, exclusive breastfeeding for the first 6 months of life, and try to stay away from water until the baby has gotten to that stage. So, but those are things that are traditional. You know, your granny will come or a grandma will come and say, "La forget picking what's up," you know, and then you're like, okay, but I thought breastfeeding is better, and then, so it really is case by case. There's a happy medium. It's a dance, delicate.
Let's go to the training again that you'll be providing, and in terms of gynecologists. Ovarian cancer is one of the leading causes for death for women, and particularly, as you made mention, regular checkups have been, prescribed, one that you can do for yourself as a woman. So in terms of moving forward, what will be the expertise after those treatments?
I mean, their expertise should be well-rounded, versed on all levels of diagnosis, prognosis, especially on those cervical cancer, ovarian cancer, because those are very, very common actually. Very, very common amongst women. Nothing that, if you catch earlier on, will kill you. Because when you catch it early, you're able to mitigate it. But when it's late stages, you're already feeling pain, discomfort, bleeding, and things like that. Many times at that point, it is, prevention is better than cure, basically. So that's what I'm trying to say. At the end of the day, we want to make sure that people understand that. If we did, we have more providers, which is what we're trying to do by training specialists in country, which has never been done before, which we're very proud about, and also educating the people that they should be coming to these institutions to get, quality care from professionals who are trained.
Okay, and to the Oladirin Children's Hospital, which have been chosen, what would you have to say to them after all of these trainings to capacitate them and ensure that, the way they get to deal with kids? Because many a time that's also another issue, parents complain that the welfare, the human interest that they get to show is sometimes lacking.
Yeah, I mean, one thing I can definitely assure people is that the residents that we have coming in are residents that are very passionate about this work. Yesterday we had a ceremony to open the program, and they each had an opportunity to talk about why they wanted to be a part of the program, and every single one of them wanted to be a part because, number one, they have kids themselves, number two, because they love working with children, and they love that children are playful, and you not have for tell when picking no well. because as you well know, you don't be easy in make. So they are really passionate about it, and we know that once they get trained, they'll be confident enough to go in and treat the patient with care, with respect, no matter how big or small, rich or poor.
Okay, when will this training end? 7 days? It started yesterday.
So it started yesterday, so it will go until 2024 because it's 3 years.
Okay, thank you very much for taking your time to talk to us. She is Leah Spa, the country director of the Mama Pikin Foundation. Don't forget you can send your comments to the number 088-373-504. Moving on with the podium, councillors of Freetown City Council have dissolved the Budget and Finance Committee. The dissolved committee, the disclosed was the reason for the issues arising in the council. They made this decision during the 32nd council meeting held in the council as well. The environment was calm when the deliberations commenced as the mayor of Freetown City Council, Yvonne Akisoya, delivered the 2 years report of her Transform Freetown project. The Transform Freetown agenda she disclosed attracted 20 projects worthy 182 billion loans. All of the said projects were donor funded, and it was observed from her presentations that the lion's share of the projects were directly implemented by the donors, with council as the only implementing partners. The former chairperson of the Budget and Finance Committee, Councillor Abiose Wilson of Ward 432, raised concerns over the financial issues in the mayor's presentations. Well, for more on this, I have in the studio Councillor Ward Kalifofana, former chairperson of Information and Communication, Ward 445, constituency 132, Lumley. Good afternoon, and thank you for joining us on the podium.
Thank you very much. It's my pleasure.
Yes, let's start with the dissolving of the Finance and Budget Committee.
I think the essence of dissolving the Budget and Finance Committee is mandatory, and then I think it is necessary because it is embedded in the Local Government Act 2004, when and how or when necessary for us to dissolve and reconstitute the committee. We, the elected officials of the municipality, we are charged with the responsibility to provide basic social amenities for our people. It has reached a stage where the chairperson for Budget and Finance Committee, who happens to be Councillor Abiose Wilson, who also happens to serve or to represent us in management and procurement meetings, there was a time we asked her for several clarification on issues bothering us as councillors. She said she has no idea or clue about what is happening. I haven't had a lot of discussion with her. At the end of the Budget and Finance meeting we held 24th of August last month, we came with a resolution that she is not competent and she is not serving us diligently. So upon it, we take it as a resolution on our council meeting we just held there.
Okay, in terms of reconstituting this committee now that you are saying Abiose Wilson of 432, did not handle properly, what would you suggest in terms of reviving what you think you've lost?
First of all, there are several issues affecting the day-to-day activity of Freetown City Council, which is not a secret, in relation to the tricycle youth groups, in relation to the signing of the iCloud accounts, and also the transfer stations. Abiose, who happens to be the Budget and Finance chairperson, former Budget and Finance chairperson, was supposed to give us a clue about how this whole thing came into existence. Surprisingly, on that day, she stood up and said she has no idea about it. So upon it, we, the elected officials, also including me, the chairperson for Information and Communication, I happens to be part of that committee, but she was our chairperson. So automatically, our colleagues raised a motion, and it was supported by Councillor Ishekweji that they should dissolve the committee because we failed in failing to get the relevant information needed. So upon it, a motion was moved and it was seconded, and also we voted. So at the end of the day, those that were in support of the motion got 28 votes, and those who were against the motion got about 36 votes. So automatically the committee was dissolved and needs to be reconstituted by no less than our worship the mayor according to the 2004 Local Government Act, and that of the Standing Order 67(1)(a).
Okay, you made mention of the tricycle youth groups, and one day I'm wondering, you talked about those who get to collect garbage. Is it?
Of course, Freetown City Council has tricycle youth groups that do get garbages within the municipality and also sweep the municipality. So at the end of the month, we are supposed to pay them, but it comes a time when the chief administrator Festus Kali failed to sign their check for more than 2 months. So upon it, we went to the chairperson, the former chairperson for Budget and Finance Committee, Councillor Abiose, for her to talk to the chief administrator to sign the documents. Surprisingly for Abiose to say she's not aware about the tricycle youth groups that have been working with the municipality for a couple of years. To us, it was a surprise. So that was why we thought it necessary for us to dissolve the committee and also remove Councillor Abiose as the chairperson for Budget and Finance Committee.
Okay, for your constituency, Ward 445, 132, rather Lumley, particularly, I have been there, on mornings that they get to sweep, because we carry the story on women who get to sweep the streets of Freetown. So particularly, how, important, well, it is important, but I'm taking you particularly to the gears they get to wear for those who get to clean those parts of the streets of Freetown.
Well, this is the major reason why we the councillors will be yearning for the removal and transfer of the chief administrator, because he is the administrative head. He is responsible to make sure the environmental sanitation officer provide gears for those people that do keep the city streets. So if there are 1 or 2 faults along the way, if the concern is being used to us as political heads within our locality, it is impended for us to raise it in council meeting, and then the issue must be addressed. But we're saying this time without numbers. If they cannot provide for them their salaries, which they've worked for a couple of months, how can they prepare for them or provide them gears to wear? So those are some of the concerns or issues that led to us with the council asking for the chief administrator to be transferred.
As a councillor as well, there was the cleanest streets or cleanest zone that the mayor of Freetown was taken through. So what would you say to some of those projects? Has it been effective or efficient?
The essence of the cleanest zone competition was for Freetowners to be motivated to keep their municipality or locality clean. That was why that particular competition was organized. But having taught it as chairpersons, as former chairpersons, last year we thought it necessary that you not only take a huge sum of money and then they allocate it to a particular community, but at least distribute those money within certain localities. Like for instance, because we have 48 wards, if let's say you consider 12 wards, at the end of the day you disburse those money amongst them until you complement it and encourage them to keep the community clean. So we've also wiped out the cleanliness competition. So now what our chief the mayor is deciding to do is for her to lobby to donor partners for them to come in and see how best they can help come the next cleanliness competition, so that we'll be able to incorporate more wards in instead of awarding the award to a particular individual ward. Okay,
this Transform Freetown project we're speaking on, overall it's worthy of 182 billion loans, of which the donors with council are implementing partners. So as a councillor, tell us some of the the ones you've achieved for, if any.
First of all, the 182 billion we are talking about is not a money that was sent to Freetown City Council. It was a money, or it was a project being implemented through donor partners alongside with Freetown City Council. Like for instance, you had while the summer was explaining about the Piki, what do you call it? Mama Piki Foundation. I worship them as one of the advocates that contributed towards the success of this particular project. That's how some of these projects are done. Like for instance, we also talk about the transfer stations. The transfer stations was a donor funding project funded by DFID. They implemented, but we went to the project. Also talking about the tricycle youth groups. These were tricycles that were given to us by CRS. So these are how some of these projects are being implemented. But what people are getting confused here is the fact being that when they had that Freetown City Council was generated 182 billion, they thought the money was sent directly into the coffer of Freetown City Council. That's not how it operates. These are projects that we do lobby for, but we do not implement them. We do not implement them. We lobby for them, we do not implement them. But at the end of the day, the credit is being given to us.
Okay, in terms of moving forward now, what do you hope to see as around of that? With all of these, monies that it's not well lucrative or sin.
But if we turn us with churches, since the inception of our worship, you've seen the transformation of the municipality in terms of sanitation, in terms of development within the locality, the cemeteries, the municipal schools, the markets. We've transformed. You go to the First Market, I've been there for a couple of years. You go to the Edgar Street Market, you go to the Lumley Market. If you go there, you meet their meal at tanks, water, one there. You check the toilet facilities there. You watch at how the cemeteries are being kept clean. I think this all compliment towards Freetown City Council.
Okay, thank you very much for taking your time to talk to us. He is the Councillor Abdul Karim Fofana, former chairperson of Information and Communication, Ward 445, Constituency 132, Lumley. Your messages can be sent to 088-373-504, 088-373-504. I still have with me Maligi Kamara, who is a tourist officer, and in terms of the sustainable development goals and the economy, tourism can actually go to countries, particularly Sierra Leone. As we move on with the program, Maliki, in terms of the areas that can be, made more appetizing for viewers, for audiences to actually go there.
Come again?
Yes, to make lucrative areas for Fritonians to actually go there.
Of course, as I've earlier on said about the economic diversification project being implemented by the Ministry of Tourism and Cultural Affairs in developing key sites within the Freetown municipality and provinces. Currently, we want to open up these places so that people can access them, Freetonian can access them. And these areas are so much attractive to tourists because considering the economic potential of this area, you will notice the massive infrastructural development that is taking place at the Aberdeen beach, wherein everybody wants to invest in tourism. But we have other areas like Levuma. Levuma also is being developed so that people can have access to that place. We are also trying to develop Laka so that people can also have access to these places. But just as I said, we don't want to focus on the beach tourism aspect. We also want to change the narrative wherein we can draw the attention of people to consider nature tourism, where they can meet with this chimp at Akugama, go to Leicester Peak. I mean, these are places which we expect Freetonians to be visiting and have the best from it, but we need to develop them.
As a tourist instructor, what would you say in terms of engaging Sierra Leoneans through local apps or sites that they can actually get to engage and see what Sierra Leone has to offer?
Yeah, in our restructuring of the Ministry of Tourism and Cultural Affairs, we're working on this perception survey, wherein the project is currently going on. We are trying to recruit the consultant to develop these apps, wherein whoever visits Freetown or whoever visits Sierra Leone as a destination, at the end of the day will give us feedback about his experience, what he loved most about Sierra Leone, what are the beautiful things. So we are working on all of these things.
Okay, thank you very much, Maligi Kamara, tourist officer from the National Tourist Board. Thank you for joining us. Over to you, Mr. Jim Kamara, Chairman, Education Committee Consultant. As we round up, those kids have received those school supplies, particularly to children of Kosotown, in terms of moving on forward.
Yes, definitely yes. On the 4th of September, which will commence on Saturday, we will distribute those school supplies to kids, 600 of them in 5 schools, definitely to the kids of Kosoto. And please, we are appealing to parents to please have your kids come along with their uniforms, so it will be a lot easier for us to identify them, and have them given their school supplies.
But quickly, a premium has been placed on, girls particularly who go to school. So in terms of your donation, were there, differences to boys and girls who receive the school items?
Oh, no, absolutely not. They are all going to be given these school supplies equally, living within their various communities, and so on and so forth.
Okay, thank you very much for taking your time to talk to us, and that's how we an end to this edition of the podium. Remind you, our quote of the day comes from Peter Coppin, a Russian economist, and it says, True progress lies in the direction of decentralization, both territorial and functional, in the development of the spirit of local and personal initiative and free federation from the simple to the compound area of the present hierarchy from the center to the periphery. Many thanks to my guests and many thanks to my producer, Samatapa. My name is Zulaya Hamid. Continue to stay with SLBC and have a good afternoon. Bye-bye.